For me, I think the pillar stone and really the core of understanding patient satisfaction is understanding quality of vision. At the end of the day, that's really what it's all about, as David mentioned earlier. And to me, the iTrace is really a big part of that. And so what is the iTrace? It's a workhorse. I mean, it does everything from ray tracing, we'll get really into, of course, but it's a topographer, an autorefractor, does wavefront Ks, a pupillometer, provides us other factors such as angle alpha, angle kappa, the center of the pupil versus the center of the visual axis, et cetera, to know is a multifocal lens maybe the best option for that patient or not as well. The other thing that you're going to hear later on is the ability to educate patients. I found it so hard to educate what is astigmatism. How do you educate the patient so they understand the value? Well, what we can do also with this is say, okay, if I don't treat you for the astigmatism, just treat your nearsighted, farsighted, Mrs. Smith. And say on the left here, see how blurry that E is? Well, look what happens when I treat your astigmatism. It clears up all of a sudden. And that is a quick understanding for the patient why we need to address astigmatism. I can show the map down below here, say, look, that's where the eye is steepest. This is why we have to take care of it. So the education part of it, which you'll hear from other colleagues, is such a valuable part of the iTrace tool. For me, it was such a valuable tool. After using the iTrace in one office, we got it for a second office because it's such an invaluable tool. Every patient going through a cataract evaluation has to have the iTrace after surgery from a post-op perspective to understand how they're doing, especially if they're not happy